Welcome, everybody. This is Deep Dive, Healthy Planet, Healthy People. Our presenter today is Dr. Joshua Weil. He's an emergency physician at Kaiser Hospital in Santa Rosa and part of the Permanente Medical Group. My name is Carrie Winninger, and I am the outreach lead at the Center for Environmental Inquiry at Sonoma State University. Our public events like this are usually done at our Osborne Preserve on Sonoma Mountain in Pengrove or our Galbraith Preserve near Yorkville in Mendocino. But for the 2020-2021 school year, everything's gone virtual. So we're really excited to have you here, help connect you to nature and learn how you can make a difference even during the pandemic. So if everyone can please take a moment to type your full name into the chat box. That's going to be our sign-in sheet for today. Sometimes your usernames are not the same as your real name, so it helps to have you sign in that way. Before I let Dr. Weil take it away, I want to tell you a little bit about what the Center for Environmental Inquiry is and how we can be a resource to you. The center mobilizes faculty, students, and community to solve complex environmental challenges, turning education into action. We invite you to join our diverse community of learners and problem solvers, no matter your background or your connection to the university, because all sectors of society, all parts of the community really need to get involved if we're going to be successful. We want you to leave today with a better understanding of our connection with the environment and with some sort of skills that lead to sustainable solutions. So there's many ways to get involved with us. You can engage in research, take one of our training programs like our naturalist or land management programs, learn about the virtual field collaboration, which is for undergraduate classes, internships, student jobs. There's data you can access. You can lead events like this if you have expertise, partner with us on projects, or help create more programs like this by donating, since these are funded completely by the generous support of donors. So thanks for joining us today. Please just know that each of you has a role to play, and I hope you will choose to get environmentally ready with us as we tackle the greatest environmental challenges in history. Today, we're going to focus on that intersection of climate change and human health. Dr. Weil will discuss many ways that we rely on the planet to be healthy for our own well-being. Some that we might already think about, like smoke, heat illness, and others we might not, including some things that are downright fascinating that I learned about when he and I were doing our pre-event meeting. So he will give us some concrete actions after that so that we can all address the health of the planet ourselves. This is one of our deep dive events. What that means is the format is pretty straightforward. Dr. Weil will present about 40 minutes, then we'll have time for questions. Feel free to email me after the event for any follow-up that you need at all, questions or comments, and I will be putting my email in the chat so that you can do that. It is the same email that was on your registration email. I'm going to do that right now before I forget. Great. So now's the time to make sure your videos are off. You're muted. I will go ahead and do that in a second if you don't know how yourself. Please keep your audio muted during the presentation to minimize background noise. And then when he's finished presenting, Dr. Weil would love to see all your faces again and hear your questions. So at that point, feel free to turn your video on and unmute if you have something to ask. If you need anything earlier, just type it in the chat window and I'll reply to you. And we do encourage you to type any questions you'd like me to ask Dr. Weil. Type those into the chat as they arise, even if it's like in 2 minutes from now. And then at the end, I'll bring those to his attention. With that, I'm very excited to turn it over to Dr. Weil.
Thanks, Carrie. Oops, it looks like you have to allow me to share my screen.
And I just did that. Thank you.
Let's see if that will work. Yep, there we go. And let me do this and share that. And then go into present mode. And hopefully you guys are all seeing my slides. All right, getting the thumbs up from Carrie, great. Well, thanks very much for that introduction. Thanks for inviting me to speak today. I am excited to be here and share this with you, and we'll kind of go through, and as Carrie said, the opportunity for questions along the way, and at the end, we'll see how long we take, but I should have plenty of time for questions. So as Carrie mentioned, I'm an emergency physician, over 25 years of practicing, most of it here in Santa Rosa at Kaiser Hospital in Santa Rosa. I trained at UC Davis in Sacramento. I grew up in Northern California. And this photo here is my backyard last September, exactly 4 weeks after we moved back into our home that we lost in the Tubbs fire. So a little level setting, I'm not a climate scientist. Sonoma State has some very good ones, and there's plenty of information out there. And I certainly pay attention to the fact that the planet is warming. I think that's indisputable. Well, I don't think it is indisputable. The planet is warming, that most of that warming has occurred in the last 35, 40 years, that it correlates extraordinarily well with the rise in greenhouse gases, which are rising at an unprecedented rate, as is the temperature of the planet. And all that brings a lot of change to us. So it hits close to home to me because I lost my home in the Tubbs fire in 2017, which I would consider a weather climate event. And because I'm an emergency physician and I see how health and wellness intersects with climate, I become curious about it. So that is my background on that. And I think when we talk about climate and health, most people would intuit certain things like temperature extremes and heat illness. Carrie mentioned air pollution and respiratory diseases, but there are a lot of other areas. So extreme weather events, be they super typhoons or superstorms or hurricanes or tornadoes, but also air and water quality. I think air is probably obvious to a lot of people when we talk about air pollution, but we'll talk about how the water quality has changed, how that impacts food sources and gastric diseases and food supply and maternal child health. One of the things we're going to see as we go through this is that while I put these all in buckets, they all interact. So when we talk about maternal child health, we're really going to talk a lot about mental health, and we're going to talk about air pollution. And when we talk about food and water safety, we're going to talk about flooding events and molds and other infectious diseases. So all these things intersect and intertwine with each other. And the good news about that is that by impacting one, we're going to impact the others as well. So there are opportunities along the way to make small changes that might have big outcomes. So I put this slide up here from the Los Angeles Times, Firenadoes, right? I always love that movie title. I never saw the movie, but Sharknado. I mean, you can't go wrong with a title like Sharknado. And now we talk about these Firenadoes. And in Tubbs in 2017, that fire was driven by hurricane force or tornado force winds. And so we have this kind of coming together of wind events and weather events and dry winds, and then fire starts, and then you get these fires that aren't just fires; they're fires driven by tornadoes or by hurricane force winds. And so, the Los Angeles Times put this title up here, "A Glimpse of the Future," and it's really the present, and it's really frightening. I mean, when I grew up in Northern California, I can think of, I really hardly have any recollection of any significant fire. Certainly there were fires in the dense forests, up in Tahoe periodically, but it was so rare around here. I mean, there was the Oakland Hills fire, and occasionally there'd be a big event. But, now living in Santa Rosa, starting in 2016, there was the fires north of here. And then, of course, there was the fires in 17 and 19 and 20. And so it's becoming the every year kind of event. And it's really changing the way we interface with our world and with healthcare, as we'll see. So I put this up here. This is from the New England Journal of Medicine and the Lancet, and they talk about climate being the greatest global health risk facing humans in the 21st century. And climate change has severe public health implications. In addition to unraveling the biological web of our planet, it's a climate health crisis that is already happening. Climate change affects human health by increasing exposure to heat waves, floods, droughts, other extremes of events, vector, food, waterborne infectious diseases, changing the quality and safety of air, food, water, and by stressing mental health and well-being. So these are major medical journals, major medical entities in the United States and in the world that now recognize and are trying to address climate, because it's moved from being, I don't know that it ever was truly esoteric, but in many people's minds, it's an esoteric threat to it is happening now, it is impacting us, and it's happening on a level that we need to be aware of, because it has dramatic implications to how our healthcare system is stressed, what it can tolerate, and where we need to put that energy. And quite honestly, what it costs. There's a huge cost to all these illnesses. And again, the good news to that is that if we make changes, we have the opportunity to save money, that there's actually a significant return on investment to lower these healthcare outcomes. And it's also important, I think, to recognize that, unfortunately, it is not an equal burden, that there is a lot of healthcare inequity. We recognize that. We've seen a lot of it through what's happened in the last year with COVID-19, but our own California health officer, Dr. Nadine Burks, people and communities are differently exposed to hazards and disproportionately affected by climate-related health risks. Populations experiencing greater health risks include children, older adults, lower income communities, and communities of color. We know now that your zip code predicts your life longevity. Your zip code, where you live in the United States, predicts your health outcome. Not weather, not your family genetics, which certainly play a role, but we can predict your healthcare outcomes based on your zip code. It's estimated that between 2030 and 2050, at least an additional 250,000 deaths per year worldwide will be due to climate change, and those countries with the least infrastructure to cope will be the hardest hit. Wealthy countries have a better opportunity, wealthy communities have a better opportunity to pivot and to make changes and to deal with some of these crises than lower income people and countries. And by the way, that 250,000 deaths per year is a very low estimate. I mean, and you'll see some of the statistics I have on premature death from fossil fuel and air quality are 10 times that or more. So vulnerable populations include those over 65. And I don't say old anymore because I'm nearly 57. So 65 is not old. It's just people who are older. Children, pregnant women, outdoor workers, and those with mental health issues. And we'll talk about those in greater detail. So what is vulnerability? We talk about vulnerable populations. Well, first there's things like exposure. Where do you live? What kind of job do you have? Do you work outdoors? Do you live in these urban heat islands where they don't have easy access to cooling and air conditioning? Are you in an area that is subject to extreme weather events? So whether it's tornadoes or flooding or hurricanes, and what is your mobility? And again, these things tie together because we'll talk a little bit about adaptive capacity, but we know that the people and the populations that were hardest hit during some of these hurricane events that we've suffered, flooding events, are people who have no transportation, they can't get out. And then of course, how sensitive are you to these exposures? And that is determined by your underlying health, if you have diabetes or respiratory diseases like asthma and COPD. Again, if you are in that older age population that is more at risk, or the very young. Children are particularly sensitive to a lot of these exposures. And then again, adaptive capacity. And that includes things like your cognitive abilities. Your income plays a huge role. Again, do you have mobility? Do you have access to transport to get out? Do you have access to flip on a switch and have air conditioning or heat? And if you don't speak English as your primary language, how is that going to impact your ability to get the help that you need? And of course, mental health, which is stressed by these events, but also may limit your capacity to respond. And by the way, a lot of the medications that people take when they are dealing with mental health impair your ability to deal with particularly heat extremes. So those things, again, all intertwine. And I like this slide. I didn't make it, but I got it off the internet. But again, I started to talk by mentioning that these things are all interrelated. And so this slide does a nice job of showing how, for instance, air pollution may lead to changes in the water quality that then can lead to illness, diarrheal illnesses, and also will impact farming and other things that will ultimately lead to degradation of farmland and other areas. And so again, these things all kind of tie together. We see that as we go through each of these buckets. And again, this is another slide that I did not make, but really kind of lays it out in these different ways that what we do, how we treat the planet leads to changes, whether that's heating or flooding, and that then these kind of underlying socioeconomic factors play a large role in our ability to respond. Again, where you live, what kind of air and water quality are you dealing with at baseline? What are the agricultural practices in your area? And we'll talk later about what changes and how farming affects the quality of our systems. What kind of warning systems you have, and again, socioeconomics plays such a large role, and we've really seen that play out in the last year. Are you healthy to begin with? What's your nutritional status to begin with? And how much access do you have to healthcare? And then again, with that underlying basis, then you get exposed to these different areas, whether it's an extreme weather event, whether it's heat stress, air quality, water quality, food supply, vector distribution, and then the social factors. And these all play out in the illnesses that are outlined below, whether it's infectious disease like dengue or hantavirus or chikungunya, which is one of my favorite medical words to say, malaria, but also heat-related illnesses, cold-related illnesses. Don't forget that climate. We talk about weather events, and then climate is the overall changes that we're going through, and that extremes on both ends are all related. So while we may have drought in the West, we may have floods in the Midwest and the Northeast. And while we may have extremes in heat, we can also have extremes in cold, like the Texas winter storms that they just went through. So these things are all interrelated. So when we talk about temperature extremes, we can look at certain data like emergency department visits and deaths, and we read about a lot of these schools, a lot of these events that occur in high schools and college athletics. Certainly I've seen them. I do sideline football as a volunteer physician for some of the high schools in the area. And I've seen days when people in the stands and the cheerleaders and the players are all collapsing due to heat. And so as we see these patterns of increasing temperature and humidity, it puts more people at risk. And I like this stat in 2019, 65 people older than 65, again, I didn't say old people or elderly, it's people older than 65 experience, and I don't know where they come up with this, 102 million more days of heat wave exposure in the United States compared to a baseline from 1986 to 2005. So I think you have to be a little careful when you look at some statistics like this, because guess what? There are more people over 65 in 2019 than there were in the 1980s and 1990s. But when you look at heat-related mortality, it's doubled over the last 2 decades, and that population has not doubled. So you always want to be a little wary of statistics and how numbers are massaged. But I think that's pretty staggering when you see that number there. And we know that, again, people over 65 haven't doubled. And then there's a cost to it as well. So this is an estimate looking at agriculture, construction, manufacturing sectors primarily, when people had to stop working because of extreme heat. And it's estimated that $45 billion were lost in wages in 2019 from some of these weather events and extreme heat. And I think this is a fascinating story. So in 2016, there was an outbreak of anthrax in a native population inside the Arctic Circle in Russia. And when they ultimately traced it back, where did this come from? There was an extreme weather event in 2016 that was the U.S. Meteorological Society tied it to human activities, and the permafrost melted. And when the permafrost melted, there were some reindeer carcasses that became exposed and warmed. And apparently, these were hundreds of years old, but were infected with anthrax spores. The warm weather allowed the spores to reactivate and get spread in the grass, and the reindeer that were alive ate them, and then the populations ate the reindeer, and then they had this outbreak of anthrax. So completely fascinating story. Just, again, when we talk about some of these areas where we're seeing things we've never seen before, we've certainly seen this in Alaska and inside the Arctic Circle, where we're seeing the permafrost melt, and in some way, a lot of ways, it's accelerated. If you look at most of the models for climate warming and planet warming, they are not actually accurate. Things are happening faster because they didn't account for some of the things like loss of the ice caps, which reflect some of the sunlight out, and some of the increased methane gas that's been released from the permafrost as it's melted. So some of these changes are actually accelerated. So extreme weather events, I think, are something that we do think about. We know that in the West, we're seeing a lot more of these so-called red flag days where we have the hot, dry winds, and they are certainly linked to increasing fire and fire danger. That fire that I had that picture of in my backyard started on one of those days. And I was really lucky, actually, that because it was anticipated that there was an increased fire danger, CAL FIRE was staged, and they were flying helicopters over our house and property within literally under 10 minutes and dropping retardant. But the fire season starts earlier every year, and it burns later, and more acres are involved. And again, when I think about how this ties to mental health, and personally, my wife and I, we love to travel, and there have been times recently where we've come up and we've talked about travel in the fall, and my wife does not feel comfortable leaving the house in the fall. And now it's getting to the point where I have to say, we have to look at this. I'm not going to get into the marital discussions that I have, but I don't want to live my life not being willing to live my home from July, June until December, because that's when the fire season goes now. So how does that impact people? Not just me and my wife, but how does that impact people to think about how that season stretches and how real that has become now? And this interesting statistic, in 2020, California wildfires burned 4% of the entire state. And when these fires burn, they let off a lot of particulate matter. And so that PM, particulate matter 2.5, and particulate matter 10, that's the size, the micron size of the particulates, and they have different implications. How far they travel, where they settle, how deep they get into your lungs. And they are a multiplier of some of the fossil fuel effects we feel. So, and they have significant health impacts. And again, we'll talk about how that plays out with maternal child health and also with air quality. But they also threaten how we deliver healthcare. Our hospital, Kaiser Hospital, was evacuated in 2017. So was Sutter. 2 of the 3 hospitals that serve this community, big hospitals, were evacuated. When tornadoes knock out, the Joplin tornado knocks out the hospital there, when hospitals are taken out in Houston, or when they're taken out in New Orleans, those are catastrophic events. And it really is a tremendous strain on the system in the immediacy, but sometimes for months or even years afterwards as they try to put those up. So again, this is another way that climate interacts with healthcare. And I mentioned before that you may have drought and heat waves in one part of the area and floods in the other parts. And Carrie and I were talking earlier, and I think we'll probably link this article later, looking at what part of the United States will become less and less habitable as we go forward, whether it's coastline because the water levels are rising, or whether it is areas that are lost to drought or floods. And Carrie was saying that the best places to live are going to be in the Midwest. So I guess now is the time to go look for some property in Indiana, although that's not particularly where I want to live. I love California. So again, mentioning other weather extremes and where they intersect, sea level rising 8 inches in the Mid-Atlantic and Gulf Coast over the past 50 years, increasing frequency of hurricanes and typhoons, frequency and strength and intensity. And again, anybody who studies weather and hurricanes and typhoons knows that the energy from those events comes from the sea. And so as the seas warm up, there's more energy that's put into those storms. And so we've seen some of those catastrophic. I responded to the Philippines following Super Typhoon Haiyan. I responded to New Orleans to help with deliver care in following Hurricane Katrina. So these events are increasing in frequency and size, and also because of where we put people and where we live. So we put ourselves in the line of some of these events. And then we mentioned the winter storms that are increasing in frequency and intensity, so the opposite end of the spectrum. So this is some data from a CNN story, and basically looking at air pollution and premature deaths. And again, like I said, these numbers are estimated, debated. I've seen actually in the New England Journal a story that put the numbers at about twice this number of basically 3 million to 4 million premature deaths worldwide due to outdoor air pollution. In the United States, close to 200,000 annual deaths due to these causes. And fossil fuels, of course, include coal, oil, natural gas, global greenhouse emissions, and the U.S. is a big part of that. So when we talk about those risks and air quality, we kind of look at the baseline, and the estimate for us here in California is that about 7,200 premature deaths annually. Of course, we intuit that that this kind of poor air quality is going to worsen things like asthma and emphysema, COPD, but also heart disease and stroke risk, and increasing deaths from those, and also impairs childhood lung development and their risk ultimately for developing asthma and COPD. And interestingly, and maybe not surprisingly, patients with underlying lung disease certainly at increased risk for complicated outcomes from COVID over the last year. And so that has put those people at a greater risk. And unfortunately, California has top 5 regions of the worst annual air pollution in the country, with very high levels of particulate matter and ozone. And these are very high in urban areas. And again, as I started the talk talking about your risk based on your zip code, this is certainly one of those areas. And this is kind of frightening to me that asthma mortality is 3 times higher in African Americans than whites. Now, I have to be honest, in 25 plus years of practicing emergency medicine, I can't think of anybody I've had die from asthma, but it happens, and it happens more in urban areas, and it happens much more in African Americans. And some of that has to do with access, but also, again, what is their kind of baseline exposure? Water quality, we can see these, when you get floods and it contaminates the water supply, you're going to get outbreaks of diarrhea-causing bacteria like Vibrio. Kids are at higher risk because when they swim, they tend to be in the water for a long time. They swim with their mouths open, so they swallow more water. Temperature changes in the water make certain areas more prone to algal blooms, which can cause fish die-offs and toxic water and pet injuries. I understand from Carrie, you guys just had a talk last week about this, or recently. There's an inverse relationship to the water temperature and the oxygen content. So warmer water is less saturated with oxygen, and that changes the populations of fish. And some of the fish that are more able to survive are ones that accumulate mercury at higher levels that ultimately end up in our food supply. So again, the web is not a straight line, but ties together. And then as we see increased CO2 and increased acidity in the water, it also affects populations like shellfish, and a lot of people depend on those. So again, the food supply is at risk. Thinking about maternal child health, this is one of those areas that is really kind of tied to some of those other areas we talked about, and then exacerbated. So low birth weight and premature labor is tied to heat exposure extremes, certainly to particulate matter and respiratory diseases, but also floods and stress. And then also to mental health. So there's a definite increase in risk for stress and anxiety for women who are pregnant or immediately postpartum. Not surprisingly, they're very concerned about the well-being of their child, and so they are that leads to an increased risk for stress. So being exposed to these events puts them at greater risk for PTSD and later development of long-term anxiety issues. And then this is one of my favorite areas of vector-borne diseases, and there's a lot of research that goes on at universities like Sonoma State, the University of Texas, I have some up there, Oslo. But basically, you know, thinking about how many of these, when I talk about vector-borne, we're talking about mosquitoes, ticks, fleas that transmit disease. And I have a list of some of the ones that are up there. We talked about some of them. But what was interesting, so the University of Oslo said, can we predict the outbreak of dengue fever in China by looking at temperature? Because they knew that the temperature was related to the mosquito populations. And sure enough, there was a very close correlation. So they could predict, look at the weather patterns and predict the heat and then predict how that season was going to go for dengue. And then we've seen a huge increase in Lyme risk in this country. And more and more counties that become carriers of Lyme, and then the season for Lyme and for tick exposure is extended. Now, generally, there's only a short period of time when the tick nymphs are transmitting Lyme, but because the weather is warmed up and we're out in those areas more, we have increased risk of exposure. And it's very interesting. This isn't directly tied to climate, but it is to human behavior. What we have done is, as we take some of these forested areas or some of these lands and we divide them up and we drive out kind of the normal fauna that lives in those areas, what we're left with largely is the white-footed mouse. And the white-footed mouse is a carrier of Lyme to ticks. So ticks that feed on white-footed mice have like a 90% chance of winding up with Lyme and then transmitting it to others and to us. So very curious how that pattern and how we have driven to our communities to a higher population of white-footed mice, because we've driven out the other predators like foxes and coyotes and some of those other animals. So that's a very interesting tie-in there. Food security, you know, when we get disruption of food supply through floods or other extreme events, but also because as the growing season changes, we see a loss of things like for the Inuit populations in Canada and Alaska and Russia they don't have the same crop that they're able to get, and they also have these crops have lower nutritional value. And it's also true of things like rice and wheat and potatoes. Now, in the United States, we're a little bit insulated against this because we tend to have the financial wherewithal to make sure that our foods are, we put additives in them. But it's a significant issue to poorer countries. And then as we see climate change, increased exposure to things like salmonella, right? In warmer weather, there's increased risk for salmonella. It also leads to increased pesticide use. And so that's ultimately going to affect our food supply. And then when you get these flooding events, you're going to wash more of these chemicals into the food chain, into rivers and into other areas. So again, looking at how all these areas intersect. Mental health, I got to move. I don't know if you guys see this, but I'm moving that over there. You know, this is a fascinating statistic, the number of children exposed to traumatic weather events and displacement. Now, we are kind of used to thinking about displacement, unfortunately, from wars and some of these other things, but obviously famine and drought and hurricanes. And again, you know, I was in the Philippines following the typhoon there, and it's just, you know, hundreds of thousands of people displaced. It's very traumatic, particularly to children. Following Katrina, 1 in 6 survivors met criteria for PTSD, and half of those people developed anxiety or mood disorders. And it's both the real threat that occurs, but also the perceived threat. Again, this goes back to what I was discussing with my wife and I go through, this perceived threat of every year, are we at risk for having a fire? And then real impacts to culture. So Inuit populations that depend on ice flows for their hunting and for their familial gatherings, and those opportunities are shrinking where we see ice melt. And then I mentioned earlier that people with mental health disorders are at increased risk, both because of the medications that they're on, but also because of their ability to have capacity to react, and because of the feedback loop that occurs with anxiety and this perception of this risk, it just builds on itself. So that loop will just keep feeding and growing. And I am part of healthcare, and healthcare is a major greenhouse gas emitter. And so I think it's important to talk about that. And there are things choices we can make. Some anesthetic gases that we've used traditionally have half-lives around 100 years, and there are other choices that we can make that have half-lives in the single digits. It's also important, I think, to recognize how much waste and landfill we create, chemicals we use, and water we consume. And this number is kind of staggering, that a staffed hospital bed, on average, 570 gallons of water a day. So what can we do? What can you do? First of all, I think it's important that you not be overwhelmed, because it's really easy to think about the scale and the scope of some of the things we've talked about and think, I can't do anything about it, right? I mean, what can I do to change a hurricane that wipes out New Orleans? What can I do to impact the food supply? And what I always try to tell people is to remember that the perfect is the enemy of the good. So if we get wrapped up in trying to come up with a perfect solution, then we will be overwhelmed and we will become frozen with that inability to act. But just doing little good things can add up to make a big difference. So talk to your doctor, because sometimes your doctor may not be thinking about these kinds of things and where it interacts. Coming to them with these questions and what are they doing and what do you need to be aware of will help make them think about it. And the more that we as a system in healthcare take this on, and like I said, New England Journal, The Lancet, this is Kaiser Permanente. We are taking these things on and recognizing it, but the more people that recognize it, we will build up that will to make things change. And it's important that you understand your own risks. What medications are you on? Are you on medications that make you more prone to dehydration or less able to control your internal temperature? And do you have access to electricity when the power goes out and you have medical devices? And what can you do about that? And these are things that should be part of your plan when we think about our having the brownouts and blackouts that we're going to have probably every year going forward now. And I think it's really important to become engaged and informed, attending talks like this, reading what you can and understanding what you can, so you can be part of the conversation. So you can make choices about where you get your health care. So Harvard Med School and the teaching hospitals signed a commission to decarbonize. Kaiser Permanente is carbon neutral as of 2020. Virginia Mason Health is carbon neutral, and they have also committed to supply chain changes that they repurpose medical devices and they save 19,000 pounds of landfill. And by the way, they saved $3 million over 3 years. So again, there is a return on investment for these kinds of changes that are positive. And I mentioned the choice of anesthetic gases. These are conversations you can have with your system. And I think it's going to be really interesting to see what we learn from this last year of COVID-19. We really moved, and not just Kaiser Permanente, but many other systems moved towards telehealth as a way to deliver healthcare and avoiding having people be exposed to each other because of COVID. But the other trade-off that we get from that, or the other benefit, is less people in their cars, and that includes doctors driving to work. They can work from home, and it certainly includes patients not having to drive in, not having to find parking, not having to take an hour and a half for a 15-minute appointment. So there are a lot of benefits, and I think we've learned a lot, and we are getting better at it, and I think it's something that we're going to do going forward. And so, that should be part of your conversation when you think about where you get healthcare. So there are other systems in the country that are moving towards carbon neutrality, and you have choices. How about what you eat? Moving towards a plant-based diet would be one of the top 3 or 4 things we could do in this country. Now, I've said this before, and I'll say it here, I like meat, I eat meat, but there are options and alternatives that are coming up. And I eat a lot less meat now than I did 5 years ago. I mean, I'm perfectly happy eating an Impossible Burger and just being thoughtful about what I put into my mouth, and it's better for my health. Plant-based diets have clearly been shown to be better for your health, weight control, cardiovascular disease, but it's also better for the planet. And, I think that Sonoma State is undertaking efforts to change what's available in the cafeteria, and you can certainly influence that at where you work, where you go to school, and of course, how you do your own shopping. Farming practices are really fascinating. I highly, highly recommend that you see a movie called The Biggest Little Farm. I think it's available on Netflix or Amazon. It's a beautifully shot movie. It's very heartwarming, and it's just fascinating what differences can be done in farming practice. Now, we're lucky to live in Northern California where people are really thoughtful about trying to make changes. So methane from cattle and meat and dairy production is a huge contributor to greenhouse gases in the United States. But there are things that can be done around diet, around methane digesting practices that can change the outlook of what we contribute. And then, of course, where you buy from and whom you buy from and how we buy and how transport. And it's very complicated to try and decide whether you're better off buying from someone locally who drives their little truck. You know, it's a or maybe a 2005 Toyota, and it's spewing as they drive around the county to different farmers markets. But on the other hand, I think more and more people are being very thoughtful about how they do their practice of farming and how we buy and how we transport food. And there's a lot of opportunity. So I think we can be very proactive. And again, this is one of those little changes that can really add up. And it's something that you can start doing today. You can be thoughtful about what you eat, where it comes from, and who you buy it from. And then you can make your voice heard. So I put this up here, that Austin Travis County Emergency Medical Services. So EMS is fire and ambulances and how they respond. So they went biodiesel hybrid to their fleet of ambulances, and they cut their CO2 emissions by 1/3. So guess what? Right now in Sonoma County, there is a request for proposal that is out for our next contract for EMS, right? Currently, we have a contract and we have the fire system and we have an ambulance provider, and that ambulance provider contract is up for bid, or will soon be up for bid, and first is a request for proposal. So you could go to the city council and you could say, how is this going to be incorporated into the request for proposal? We want to see a proposal that will include converting the fleet to a biodiesel hybrid fleet by 2030 or by 2025 or whatever it is. And we can have our voice heard, and these are changes that we can make. Petaluma was in the news. If you listen to Wait, Wait, Don't Tell Me on NPR, they mentioned Petaluma because Petaluma passed regulation that basically they're going to ban any new fossil fuel gas stations. They recognize the direction that we're going, the city council there, that, you know, combustion engine is on its way out, and electric cars and EVs and other alternative fuels are on their way in. And it's an opportunity to encourage that by making those kinds of changes. So these are opportunities to be heard. And of course, staying informed, coming to talks like this, reading what you can, having an understanding are all things that you can do and make a difference. Small differences add up to big changes. And I love this slide. So this is the Lhasa Plain in China. And the image on the left is what it looked like about 15, 20 years ago. Historically, it had been a fertile valley that was farmed. And then the farming led to silt runoff, which changed the water, which changed how much water was retained when it rained, and it turned into this arid desert. And this group came in, and this is rural China. I mean, they did this by hand. They brought in planting changes. They terraced by hand so they could get plants to stay and survive. They changed their farming practices. And within about 20 years, they turned the arid valley on the left into the fertile valley on the right. And now they are looking at whether this can be done on larger scales like the Sinai Desert. There's historical evidence that Sinai was once fertile. There are other examples. For instance, in Spain, they looked and they said, how come in eastern Spain we used to have these summer storms that would bring us rain and would help the area be more fertile? And those rains have gone away. What happened? Well, when they looked at how human behavior had filled in some of the wetlands that were on the Mediterranean coast, and whether it was from urbanization or from farming, they took out some of these wetlands. And the winds that would traditionally bring that, come off the Mediterranean with some moisture, pick up extra moisture over the wetlands, and then drop that moisture as rain in southeast Spain. Well, that wasn't happening anymore. And instead, that rain and that precipitation was getting diverted to Germany, where they're now having floods. So now they're looking at those patterns and saying, what can we do? So there are opportunities. There's a movie called Green Gold. It's like a 45-minute film on YouTube. You can watch that. Don't get it confused with Green is Gold, which is a movie about cannabis farming. But Green Gold is a very interesting movie about this effort in China and other efforts like it. So I think there are definitely choices for us to be made and opportunities and really reason for hope. And that's kind of where I wanted to end. And so that is my last slide, and I'm happy to open it up for questions now. I'm going to let Carrie moderate that.
Awesome. Thank you so much. And what perfect timing. So we have 12 minutes for questions, which is absolutely ideal. We already have 3 people that have asked questions. So now's the time, people. If you have anything that you want me to ask, go ahead and type it in the chat. If not, then you can raise your hand and I'll call on you or unmute you and then you can ask. So thank you so much, Dr. Weil. That was really fascinating. And there was so much information there, like just totally packed in. I feel like I learned a ton. So let's just go through these 3 questions first. So Mariah asks, is there anything being done medically to support mothers with postpartum depression?
Well, that's a really good question. I mean, I think it's always very high. First of all, let's just acknowledge I'm an emergency physician, not an obstetrician gynecologist. But I think that is something that we are much more acutely aware of now than probably 30 years ago, and maybe even 20 years ago. So I think it's something that obstetricians are on the lookout for. I'm not, again, it's not my area of expertise, so I'm not aware of any specific work that's going on around it, except to say that it is certainly very much recognized now, whereas I think, 20 or 30 years ago, it maybe was not as well recognized. But I can't speak to any specific research.
The next question is from Renee, and it's a long question, but it's very detailed. I like it. So Renee, if you want to speak to it, you can, but I can just ask this question that you wrote. Great. It's a seasonal wildfire related question. What are the risks of secondary chemical emissions from fires, including introduced chemicals, pesticides, herbicides regularly sprayed in vineyards throughout Northern California? When these chemicals, known carcinogens, are burned at smoldering levels, they can be released in smoke, leading to widespread potential exposure. So has the link between fires, carcinogenic chemicals introduced to vineyards, and exposure to these chemicals in smoke that may lead to poor health outcomes in cancer been examined as additional health problems related to fires and climate change?
So it's a great question. I'm not sure specifically around research into chemicals related to our vineyards and to this area, but there is very clear research and outcomes related to the chemicals that are released and inhaled following a fire. So they said that following the Tubbs fire, I didn't lose one there. There we go. I just want to minimize that. Following the Tubbs fire, for people who walked around and weren't using masks, that it was equivalent to smoking 50 packs of cigarettes after the Tubbs fire. So now we felt that and saw it here in Sonoma County. But to your point, Renee, people down in the South Bay were inhaling those fine particulate matters that also include those chemicals. So it is very clearly a risk. And there's, some of it will be not known for years because it's being studied now. UC Davis undertook some pretty significant data gathering with blood sampling and histories and physicals, particularly around pediatrics and maternal child exposure following the Tubbs fire. So that's the kind of thing that's going to be followed out for the next 5, 10, 15, 20 years. So you're absolutely right that all those things are not only put into the air, but put into the water systems, right? Because, think about all the runoff that occurs either immediately, and that's why, right, if you lost your home or you drove around the county, they put up all those wattles to try and prevent the water runoff that was inevitable and was going to bring a lot of carcinogens from homes, right? I mean, homes that burned up and had asbestos and other things in them, and other chemicals that you point out from vineyards and things like that. So absolutely a risk. and absolutely tied into all this that we're talking about, how it's not just a straightforward single straight line, but a web of interaction.
Yeah, I love that question. That was great, Renee. Yoriko asks, how do the premature deaths from PM 2.5 particulate matter show up in the emergency room or statistics? Heart attacks?
Yeah, that's a great question. So if you think about a disease like emphysema, COPD, it is a progressive, unrelenting disease. So when you get diagnosed with emphysema, we are not going to cure you. It's a downward trend, and you have exacerbations. You get worse, maybe you get a little bit better, but you don't ever come back to where you were. So it's this kind of steady downward climb. And so when you have an event where you have these exposures which exacerbate your emphysema and further decrease your respiratory and lung capacity, and you're not going to make it back up to that level, so it accelerates that downward course. And then there's also clearly a tie to stroke and heart attack, and those are the things that I see in the emergency department. So obviously, you can't just look at one person and say, oh, that person died of a heart attack, and that's because of the increased particulate matter that we have. But when you look at population data, that's where you derive some of those statistics. But on an individual level, emphysema is a great example. Every time you take a hit, every pneumonia you get, every exacerbation of your COPD, every hit you take knocks you down further, and you're not going to make it back to where you were, and it just progresses that decline till you die from your emphysema.
Someone else asks, what's more of a comment? When you say the perfect is the enemy of the good, can you expand on that a little bit?
It's kind of a personal philosophy. I think I see it everywhere. I see people, let's talk about EV cars. People say, well, you don't have, you might run out of electricity and you have to stop and they come up with all these reasons why they shouldn't have an EV car. Yes, the perfect EV would be able to self-generate while it was driving in the sun and would have a range of 1,000 miles and would quick charge in 3 minutes. That would be the perfect EV. But it doesn't exist. But guess what? You can do really well with a good EV that gets a range of 300 miles and charges in 45 minutes, which you're probably going to, if you're going to do a long drive. I'm fortunate to have a Tesla. It's an amazing automobile. And guess what? They keep getting better. So I think if we get caught up on looking for the perfect solution, I see this in politics all the time. Whatever thing that we want to solve, that we want to tackle, we get caught up in trying to come up with a perfect solution. There's always a reason why it's not perfect and why there are things that could be better. But if you spend your time trying to come up with a perfect solution, you will never get there. But if you accept that good is often good enough, then you can move forward and you can work on getting better. So you start with good and you aim for better. And, ultimately you would hope for perfection, but you have to accept that you're not going to. And I just see too many people get caught up and not trying because they don't see a way to get to perfect. So I guess that's what I mean by that, is you don't have to get to perfect, that you should be happy and satisfied and accept good and move forward and keep aiming for better. So the philosophy I try to remember.
I like that. Someone else is asking if you can tell us more about what we can do. Shopping, farming awareness, volunteering, influencing local and further government issues. Can you also remind us of the one that you spoke about with EMS fleet services?
Sure. So again, our emergency medical services, this is a great opportunity right now. So the city council and the county are right in the middle of what's called an RFP, request for proposal. And so there's been a lot of background work that's been going on for the last 2 years. Currently, American Medical Response is the ambulance provider for your county EMS services, and they work in conjunction with the county fire. And different people are going to put in bids to try and get that contract. And I think it's going to be April 14th is the next city council meeting that will be talking about this. And so you can reach out to your supervisor and say, hey, I know that this is being considered. Is there anything that the city council is looking at in the RFP to include fleet modernization, to include biodiesel and hybrids. And so that's a great opportunity to have an influence and to bring it up. You know, I think farming is a really interesting one. And again, I just would.
I want to jump in really quick. Is that the Santa Rosa
Sure.
City Council?
Santa Rosa City Council, yeah.
Okay, just someone's asking about what.
Yeah, or is it Sonoma? It's actually Sonoma County. I'm sorry, I think it's Sonoma County.
Great.
Yeah. So, so, you know, and again, it's not my area of expertise, but I just see more of it like that Wassa Valley or Wassa Plateau, that there is an example of techniques of farming. And again, it's a beautiful movie, the Biggest Little Farm. Highly recommend it. Cinematography is amazing. But really just shows, and more people are starting to adopt those techniques, but they're done on a small scale, right? Because, you know, big, what's the word I'm looking for? Institutional farming, you know, they're not interested in that, but they could be. And certainly if we support the little farmers that are doing it, it's an opportunity. So, you know, trying to think of what other examples that I can give, but, you know, those are little things. And you know, and again, I think one of the biggest things that you can is just paying attention to a plant-based diet. There are lots of information about a plant-based diet. And I think that's a really, I mean, like I said, that's like one of the third or fourth biggest changes we can make if we move our population to plant-based diets. And so, you know, there's lots of information on the internet. And again, the perfect is the enemy of the good. I try to go plant-based, you know, I miss cheese, you know, but I can cut a lot of meat out of my diet, you know? And so, so there's a lot of things that you can do, and that can improve it. So research a little bit about plant-based diets, ask your doctor, you know, if you have Kaiser Permanente, they have all kinds of information and classes on it. But I'm sure the internet is rife with information about plant-based diets. And that's a really small change that you can make. You can encourage others. You can encourage Sonoma State, your workplace, to change what they have in the vending machines, to change what they have offered in the cafeteria, and that can add up to a big difference.
And especially with it being Earth Month, basically right now, right? This is a good time for this. And there's so many plant-based foods coming out right now. Just this week, because I actually am mostly plant-based, so I stay on top of this, and just 3 different coffee shops that I go to just in the last week started coming out with like vegan breakfast items, you know, things like that. So using like Impossible and Beyond Meat and things that are very convincing. But
yeah.
And I remember you mentioned, Dr. Weil, when I first heard you speak a couple years ago about talking to your doctor about maybe the way that you do routine testing or how often you use certain equipment in the hospital, because that generates a lot of carbon.
Sure, it's a great point. I'm gonna just time check here because I have another meeting I have to get to shortly, but we'll finish maybe with this point. So, right. So I mentioned what a big utilizer healthcare is, and so examples are, you know, things like MRIs and CAT scans and laboratory tests, and I think they consume a lot of electricity, and laboratory tests a lot of chemicals, and I think we want to be thoughtful about how we practice medicine and what. You know, so when someone comes to me and says, I want a CT, what do you want that CT scan for? In other words, we should be evidence-based in the way we practice medicine. If you hit your head and you have a severe headache, yeah, I'm going to CT your head because I'm worried you have a bleed. If you are waking up every morning with a severe headache and you notice a little tingling in your right hand, yeah, I'm going to get a CAT scan because I'm worried you have a brain tumor. But if you have, you know, little Johnny ran and bumped his head on the table, and now is acting completely normally. Not only do I not want to expose little Johnny to the radiation, that's the main reason I don't want to get the CAT scan. But I also, you know, being thoughtful about where we direct that energy, should probably avoid using that CAT scan just from a global perspective. So, you know, my main focus is on doing what's the medically evidenced and the best practice. Again, weighing everything we do in medicine as a risk versus a benefit. You know, if I scan a 5-year-old with a CT, there's a 1 in 2,000 risk of a lifetime developing a head and neck tumor, versus an infinitesimally small chance of finding a meaningful bleed if this child's behaving normally and had a minor injury. So everything we should do should be evidence-based, and you should always have a conversation with your doctor about what is the evidence and what are my risks and the benefits, and everything. I won't go a long story, but one story I had as a woman I saw early in my career who was 35 and had a history of heart attack and stroke. I'm like, how in the world did that happen? She'd been prescribed antibiotics for an infection she probably didn't have, sinusitis, right? It's way overdiagnosed. Probably harmless to give this poor person some penicillin. That's what got prescribed. She had an allergic reaction to it, got a little hives, then was given epinephrine, which she probably didn't need for a little bit of hives, right? You use that for anaphylaxis. That epinephrine induced a heart attack and a stroke in her. So little choices we make that are not evidence-based sometimes can lead to, there's a risk that we don't always recognize. So that's the little tie in there. So.
And I know you need to take off. So everybody, I just want to do a quick wrap up. Thank you so much, Dr. Weil. I mean, people are clearly wanting to know more here. So is it okay if I give folks your email if they have anything to follow up later?
Yep.
Great. I will send that in the email I sent everybody later. And I really hope that everyone here feels more empowered and informed to take action, because I really love how clearly you laid that out for folks. Like, we can do something about this connection. It might surprise you, like I said earlier, that all of our public events are actually completely supported by donors. So if you guys did enjoy this and want to see more and have the ability to, just consider contacting me and talking about a donation. And if not, then just keep coming for free, because we love seeing you all here. Contact me for any of that. I put my email in the chat earlier. And I also just want to say quickly, this is only one of 19 virtual events we have this spring. So if you want to take a look at our calendar, I went ahead and put that in the chat just now. I want to highlight just a few of them that are coming up. Next week, we have an event showcasing 3 researchers from across the country, all studying carbon and cycling and storage of carbon. It's called a Live from the Field event, which is the 6th one that we have this year that are all part of this international collaborative project that's aimed at undergraduate classes, but it's open to everybody. And they're made possible by through an NSF grant from a project called The Virtual Field. And you can learn more about that at thevirtualfield.org. Then we have another Live from the Field event next Wednesday. So we have one Monday on carbon, one on Wednesday. And Dr. Weil, I think you have to take off, right?
Yeah. I got to run.
Problem. Thank you so much.
much.
People are writing comments about this, how much they loved it. So thanks again.
Good. You bet.
See you later. And then after the one on next Wednesday is called Live from the Field, Climate Change in Our Watershed. So this one is actually taking a look at our local area, looking at somebody who works at Sonoma Water as a scientist and somebody who works as a science professor on campus, looking at that same topic, but from an academic and an applied perspective. So that one's going to be really fascinating. If you're an instructor, I highly recommend you take a look at these Live from the Field events. There is one more too on May 13th, all about how field station research impacts society. So that one's really fun. Then 2 more quickly to mention. There's an event coming up that's bilingual, and it's citizen science, and you can actually go outside and do something, not just sit in front of a computer. It's the Sudden Oak Death Blitz. So you can go out with your household, collect leaves in nature, put them in these little mailed-in packets and send them into UC Berkeley to test them for free. So also, if you have trees that you'd like to get tested, bay laurel trees or tan oak trees, you can get those tested for sudden oak death for free. And that's going to happen on April 30th. And then the last one I'd like to mention is called Deep Dive Water and Homelessness. This one's on May 8th, and it showcases student research at SSU that was done as part of the Rising Waters Initiative. And that includes many partners, including faculty here, Sonoma Water, the cities of Rohnert Park and Santa Rosa, North Coast Water Control Board, and the Russian River Water Association. So it's a big collaborative effort, a multi-year initiative, and it's really about studying and identifying potential solutions around that nexus of water quality and homelessness in Sonoma County, which is a really complex issue. This year, starting by looking at restrooms. So I really hope that you'll come see what these students have done, because they put in a lot of work and it's really fascinating. So just a quick reminder that you can attend virtual events from anywhere. So my father is attending from Maryland right now. I had a friend present from Switzerland a couple weeks ago. So just tell everybody these are recorded so you can access them later also. And all of those are at our website. So thank you all so much for attending. Please let me know if you need anything. We hope to see you soon. Bye-bye. Thank you, Kim. She gave me a compliment about my hair. That's so nice of you. Everyone, it's been so fun.
You're so welcome. It really, you were just totally on today, and it was really fun to be part of this. So thank you. And it was a wonderful, wonderful um, uh, presentation.
Wasn't
And I
he
felt
great?
exactly the same way that it's another way I will put it, and I will leave too, is there was a sign that said, never do nothing because you can't do a lot. Do what you can.
Mhm.
And I think that that's so important. Just do what you can, and don't let that you can't be everything and you can't solve everything stop you.
Right. Everybody
Well,
doing
thank you.
something is going to be better than one person doing everything.
Totally down. Totally down.
Oh,
Okay.
I'm so
See you
glad you came
later.
today, Kim. Thank you.
Yes. You're
Bye,
welcome. Thank
everybody.
you. Bye-bye.